Ближе. Yes, a little bit. Yes. Hi everyone. No? Hi everyone. Today my topic is MESOtherapy treatment is key therapy. We are for the sound. I am fine, but oh, that's fine. That's normal, I think. Yeah. Ah, very good. Very good. Yeah. MESOtherapy is a key treatment to maintain of usefulness of skin. And may I speak was yes was yeah. Hi everyone. Today my topic is MESOtherapy is a key treatment to maintain the usefulness of skin. Yes, it is very important to make volume, to reduce the lines with filler, but it is not less important to improve the quality of skin. And one of the most important I am a dermatologist and I'm using this product already of more than 5 years. This is in one hand, and another hand I'm already in this field more than 18 years. And I found that it is very important to make, we should offer to our patient as big difference of treatments as possible, because everyone is reacting different, and everyone is it is necessary to give the patient directly what they need. Of course, MESOtherapy is one of the thing that you can't see the result immediately. You can't just take a mirror after the treatment and see the difference. But this is good, and this is maybe you have to create the good relationship between doctor and the patient to build up this trust, and they see that little by little, like a pearls on your jewelry, it will create better and better quality. So what we should expect from MESOtherapy? It's photoprotective. This treatment is create some kind of photoprotection, and I'll show you later the science behind this. The brightening, bring the brightening, reduce fine lines, and improves the skin tone. This is very, very important. Of course, this is our dream to make this lady. By the way, this is my mom. Now she's 85, and the next big picture is she's 35. So yes, unfortunately, it's just a dream. But maybe some days we can do something like this. It is very difficult to speak when we speak about skin tone, the brightness, the small wrinkles. Very difficult to say something evidence-based. Even it is some kind of, doctors are inventing some kind of objectivity, how to see what is the difference. Even it is, I'm saying again, very, very difficult to say, because you know, everyone can say, you know, I get in love, I rise my hormones, and that's why I'm looking brighter and I'm looking nice. Or I have just vacation and that's why I sleep well and so on. And it's, you know, it's difficult to say that it's really is histology, histoimmunity, but anyway, these methods do really exist. What is experimentally proving that hyaluronic acid really induce the fibroblast to produce the collagen. And this is, you know, really evident base, and we can see it on histology. And this is very, you know, it is important for the doctor because when you're doing something, you have to believe yourself. When you see that this is a really scientific data, you believe and you can share this believing, and doctors and patients trust you and make these treatments. At least one. Afterwards, they will come back and say you know, we did this and this and this. We do not need more volume here, and the wrinkles are okay. But the skin, we still want something. Especially this is a question about around the eyes, about the neck, and this is something which I show you today. The products which I'm going to use is MESOpure. It is a hyaluronic acid, small chains, not cross-linked, but it's very high concentration, 15%, and it's good for all kind of treatments, including needling, including whatever you need to do as with this product. And another one is mesobilamine. If MESOpure is just hyaluronic acid, mesobilamine is a complex product with hyaluronic acid and 18 amino acids, which simulates the hydration, rejuvenation, and improve the texture of the skin. Treatment protocol is very different. Each doctor adjusts to their patients, but this is normally I'm saying to see the difference. Especially I'm saying that the difference will be if you wake up in the morning and your face is wrinkled by your pillow. When you, after the treatments, when you wake up, you will wake with fresh, nice face. And you know, even in our language, in Romanian or Russian, people do not know the phrase fresh face, because you can receive this effect just by making a MESOtherapy. The microinjections, as superficial as possible, non-cross-linked hyaluronic acid as the level of dermis-epidermal junction. And it should be 3 sessions each 2 weeks. Yeah, I hope the video, but I think it will be live. And the summary, the MESOtherapy is as well as the needling is a very, very good supplemental treatment to maintain good, useful skin. Among the PRP, energy-based device, and so on. It is very less side effects. It could be bruising, of course, because it's needle and multiple injections, but it could be like a herpes simplex like a complication, but it's very, very rare. And I think this is excellent treatment for the zone, very delicate zone around the eyes, neck and décolleté, and hands. That's all, and I'm going to make a live. Okay, thank you. Спасибо за поддержку.
He starts again to record, especially CollaPen we need to record. CollaPen we don't have any. Hello? Hello? Please, please. Let her record again from the beginning. Sorry. No, no, she didn't have to.
Yes. Hello.
Hello.
Better, much better. What I'm going to do now. What I'm going to do now, I'm showing you the very nice treatment with CollaPen. It is minimal invasive. It could be minimal invasive practically from you do not see anything macroscopic, but anyway it will be a collagen stimulation. Or I can be very aggressive and do it very deep, and the collagen production would be much more, but it could be bruising, it could be a little bit painful. Of course, it would be an edema, but we can work with this on stretch marks, on scars, on the tissue that we need to remodeling, which we need to improve the collagen and to, it's like one of the very, very effective procedures to renew the skin. It depends on the depth. I start just very gently, but I'll show you a different technique. If I am constantly moving, it's less trauma. The needles are moving very, very fast, and it's less trauma. If I want to improve skin, especially on the wrinkles, I'll do point by point, and this way it will be more traumatic but more effective. Sometimes I'm using this treatment for the area around the eyes also. Even I know that tomorrow it will be quite big swelling, but anyway the result is very good. And after I do these very small microscopic holes, I apply hyaluronic acid like Mesopure or Belamine, and it is most important that I lay one layer and let it get in the skin, and after 10 or 15 minutes another layer, and it is scientifically proved that these products are penetrating better and better and better. We also can do this treatment not only the face or neck, we can do the arms or even forearms. So this is, let's say more or less non-consumable, and we just need some products. Yes, we can do it with hyaluronic acid, but if you apply just another serum or vitamin C or whatever you have, it will be very, very effective. As a protocol, it is necessary to repeat, of course, because all the treatments which are supposed to induce the collagen needs to be repeated. I recommend it at least 3 or 4 treatments every 2 weeks, if it is possible. If not, let it be once a month or once before the summer, at least to refresh the collagen and the appearance of the skin. The product looks like that, and I can use it also like normal, let's say classical mesotherapy, and I want to show you that it could be done with very, very small needle with 32 gauge. If you transfer from the bottle, from the vial to the insulin syringe, and it's going very easy, very nice, and you should believe me that I transfer from the bottle. I take quite big needle to take the product from the vial, but when it is already in my needle, in my syringe, it's going very easy, little by little, and I can make very, very small. And be almost no visible. You see, I can make drops bigger, smaller, and it is very, very, less consuming. Is it painful? A little bit. Less consuming, and not losing any products. You just солнышко больно, моя хорошая. I understand that it's been a long day and a lot of other different pain, other doctor's hands. But something like that, you see the populace, and I want to emphasize this is a product with peptides. It is not only hyaluronic acid. That's why it is a little bit more swelling, but that's fine. In 10 minutes it will disappear. And you see, less than 0.2, I make almost the complete neck. And my CollaPen, it looks very nice and works also very nice. Чувствуешь что-то? Царапается? Нет.
Как микродермообразие,
Да.
да?
Ну, не то, что дермообразие, это все-таки иголочки, которые... Если я остановлюсь в одном месте, оно будет гораздо больнее, and you see the small drops of the... А так микроскопические вколы. А если я остановилась, иголка I'm sorry. Not see. Okay. That's I can when I'm several times on the way I can put it. You will see even some even I am not very deep. You see some blood spots. So it's not only depending on the depth which I which I put it before, but it's very important how I am moving. And this is very nice thing of the CollaPen, that I can manage the zones which I want to be very good working, or something where I can just to refresh the skin. That's like this, and I'm moving quite fast. If I am not fast, it will be more trauma, and tomorrow it could be like a small crust, even crust. And do not forget to apply several times the serum or the hyaluronic acid. Болит? Отлично. Это намного более нежный и тонкий. It's much more professional, let's say, because we can choose the depth of the, you see, the redness appear. And we here where I work a lot, but no blood. I can do with blood also, but you know, the interesting thing with stimulation is that we do not need to go too deep, because the most important layer which gives the mitotic activity, it's basal layer. It's before the first capillaries. So redness is fine. Small bleeding is okay, but not too much bleeding to get a good result. And that's all. Потому что тебе сделали другое. Да. Давай пройдем еще раз Ирина переживает. The anesthesia is not necessary, but it's good if you apply a little bit of anesthesia. But I shouldn't be too aggressive, because tomorrow it will be a little bit like crossed. Можно, сейчас сделаем. Уже раскрутим его на одно. Сейчас. I see, I know that it's painful, but I want, especially here, is a lack of collagen. So that's why I'm a little bit more aggressive, but still no blood. That's all. And I have to apply some, let it be from here. It's just a drop. I have, and it's better to have, oh my goodness, sorry. Yes, it's too lazy. I'm moving too quick. Что? It's better to just clean up your fingers a little bit with, and just apply a few drops like this, and just spread it. And normally in our clinic we leave the patient to relax, to listen good music for 10 or 15 minutes, and afterwards we apply another layer and another layer. And that's all. Не. Уже без. Yeah. Yes, I do. So Yeah,
patients also.
yeah, yeah.
There is
I need раз, двое губ. You already have it.
there's three
Three.
labium.
No,
Two
three.
labium nodules.
No, no. This is labium. This is I don't know where it is.
Cutis. It's cutis.
Can you
Labium.
give me?
It's labium.
This is labium.
Full labium. With lidocaine already.
Oh,
She mixed it in this.
okay.
This
Okay.
melody, so what you
Okay.
can do.
Just give me one.
The rest is for you.
Yeah,
if you want.
this is you take with you. This.
You need more.
Uh,
So cutis.
yeah, one more is enough. Yes.
Okay.
Yeah. So, this
No, stay with you.
stay with me. Okay. Stay with me is good. Окей. Так, все, я вас попрошу все-таки встать и закончить с губами, потому что там уже лежит открытый шприц, который мы должны закончить. Сейчас. Так, и все-таки держим, наверное, я вас буду
Держать,
использовать.
да, я буду держать.
Так, и одну сухую. Так, давайте мы с вами обсудим. Мы хотим слегка губы. Мы не хотим их большими. Мы не хотим, мы просто хотим их омолодить, оживить, немножко, может быть, несколько вот этих начинающихся вертикальных морщинок проработать. И больше ничего. Так, сейчас, одну секунду, извините. Моя неправильная маркировочка. Теперь будет все правильно. Я надеюсь, что там еще есть немножко лидокаина, поэтому вы головушку ровненько, все отлично. И поехали. Солнышко, маленький, да, расслабились, думаем о хорошем. И теперь маленький вкол. Хорошо. Я очень медленно. Отлично. Отлично, мое солнышко. Мы именно заполнили вермилиум. Вермилиум — это граница между белой губой и сухой слизистой. И все получается чудесно. Сейчас тут маленькая морщинка закралась. И мы ее должны убрать. Я вас накормлю немножко ватой, но дело в том, что
Да
просто,
ничего себе, да.
просто там маленький сосудик, и я не хотела бы, чтобы вы... В любом случае это будет, но чтобы он был небольшой. Абсолютно нормально, что немножко крови. Без этого не бывает. Мы живые. Идем вперед. Другое дело. Солнышко еще раз. Больно неприятно. Хорошо. Очень важно именно получить вот это переход розовой губы, получить его плотненьким, и он будет являться it will be the support, not to make in the future like a prophylaxis of future wrinkles. That's all. And this is my way to make lower lip and invert it a little bit. I know that nobody likes blood with needle. It's not possible to avoid it, and I think that it's not a big deal, not a big problem if you see some blood. And another last one. That's all. I'm trying to mold it to feel where it is. That's all. I just want to be sure that it wouldn't be bruised here, and I want to keep it to compress, and that's all. Все равно будет. Sorry, но все равно будет.
Синяк?
Угу.
Ничего страшного.
Вы принимаете что-то, аспирин, кардиомагнил, что-то из этой? Нет. В общем, значит, в хороших условиях я бы сказала, что сейчас нужен лед, и вы, может быть, подниметесь и где-то найдете его. Сейчас это уже не кровь, а это мой карандаш.
Давай сюда.
Да. Сейчас я хочу чистую новую. Брызнем. Ой, извините.
Да, все нормально.
It's not good for the picture with bruise, but the сейчас подержу чуть-чуть. But the lips are very nice, and this asymmetry will disappear tomorrow. Столько ждали, бедненькая. Давайте вы сами прижмете. Сейчас я сбрызну, и вы еще прижмете. Сейчас вот так и вот так. И вот так вот плотненько, прямо в губу. И ура! I think yes. I'll do. Okay. We stretch a little bit skin and make very, very tiny boluses. you see, you feel like only touch the skin, but I'm trying to be as superficial as possible to leave the product as long as possible to stimulate the collagen, because when it's too deep it will disappear very quickly and the stimulation wouldn't be aimed. On the line I can be a little bit more aggressive and make like, well, it is a little bit painful, but my patient is very good, and it's just retrograde very tiny amounts of the product, not to create a strangulation line, but it is very important to improve these small lines. And normally we do not have too much to offer for these lines, but mesotherapy is a one. Yes, it could be some bruising, but it will disappear in a few days. And if it is happened any bruising, I'm saying to my patient that don't worry, the bruising is anyway some kind of formation of extracellular matrix. So it's good, especially here where the skin is so thin and have no support, almost no support. And you see, I am very quick and болит. That's always, décolleté is much more painful, and I'm trying to breathe with my patient together, and that's all. We're almost done this part. Ooh. The summer is coming, so please, we have to think about our décolleté. I'm going to move to another part. Oops. I hope you see that it is very small bubbles, and it will disappear not tomorrow but day after tomorrow probably. On the face I can promise that it will be tomorrow evening, but on the neck and décolleté it stays a little bit longer. On the lines, even I know that this product is not cross-linked, but for this, the lines where we have no too much support, it works very good. It will not disappear completely, but it will smooth and will be hydrated and will be fine. Just a little. And I'm very happy that the syringe is 2.5 ml, so I can do all over. And that's all. You notice a little bit of redness because of anesthesia. Here I'm putting my boluses as each near another to improve these lines also. Все, солнышко мое, все отлично. Something a little bit more. And that's fine. You know, I can say that everyone from 22 is already good candidate for this treatment, because only on 22 we are in perfect hormonal and you know, really young. After you celebrate your 25 birthday, you have to think to maintain. This is kind of treatment to maintain and to improve. If you want to improve, you have to make this treatment more oftenly. If just to maintain, at least once a year or maybe more. That's all. Так, да. Thank you. Thank you. She smiles even without anesthesia all the